Okay, so this week, a topic that I wanted to talk about was us as in chiropractic neurologists versus neuropsychs. And this comes up in the world of concussion and TBI, since I deal with a lot of car accident cases. With it, when it comes to a car accident case, the insurance machine is what I call it. They are concerned about the diagnosis and the prognosis. That's what dictates the money in the case. That's it. You and I care about helping the person, but you have
That's
to
the
you have to
point.
take
Yeah.
that all into consideration because if there's no money for them, then you don't get paid to help the person. I'm not in the car accident. I'm not a free clinic, right? So
Right.
there's that kind of aspect in understanding it. So commonly what has been done, because there aren't many chiropractic neurologists out there, let alone ones that have their fellowship in traumatic brain injury or focus on concussion, um, I find that attorneys in particular, because they're usually, I like patients, especially with a TBI, to work with an attorney because their brain's broken. If they're talking to an adjuster, they're not fully there. I don't trust that. I'm like, you need another brain basically working this for you is how I view it.
It's how
A
to make
neck
good decisions.
issue,
Yeah.
a knee issue, maybe not. Maybe you could do it yourself. But in
Yeah.
general, for TBIs, I generally recommend attorneys. And I'm particular about which ones I work with. But the attorneys always want to send to a neuropsych. The neuropsych will do a bunch of computer tests. They don't even do a physical exam. They don't look at pupils, autonomics, motor movement, vestibular. They look at none of this. It's all a paper, all long tests. It's hours long, and they write a report. And at the end, they say, "Oh, you should go see a vision therapist, a vestibular therapist, a
Maybe. I
talk
mean, maybe
therapist."
maybe they make those referrals or those
Yeah.
distinguishments,
But
or
that's the whole
or
point of the report. That's the whole point of their report. So all this money goes into this test, which is still not helpful or diagnostic to therapy.
well, and the thing to consider with this is remember, I mean, everybody who's in the world of concussion as a spectator, say, or so on now, like the most prominent thing that we think of is like the NFL or college football or things like that.
Hmm.
And remember the thing that these people have to do to get cleared to play again is pass an impact test,
Yeah.
which is what? It's a neuropsych inventory, basically, that's been computerized. And the reason why this has become the gold standard, and
The
a
guy
lot of
who
people don't
created
know,
it was on the board.
the guy who created it was on the first annual sports consensus and concussion board.
Hmm.
So there were some things that came into play that maybe, these days, like when we speak, we always have to say if we've got disclosures where we talk about it. Like when I talk about the pupillary light reflex app, I say I own, 1% of 1% of 1% of 1% of a share in it because they were doing a little bit of crowdfunding with the clinicians who use the app as a way to kind of develop some things. And so I'm like, I think this thing's going places. I'm going to buy a little bit of a piece of it.
Hmm.
But I have to say that before every lecture. I don't just go say, and I don't get like 2 cents out of every PLR that somebody buys or whatever.
Yeah.
I wish I did. That'd be awesome, especially when I'm like, hey, I'm going to do one at this postural neurology conference that I'm speaking at next month or whatever,
Yeah.
because I'm talking about the PLR. But that's the thing is that the neuropsychologists kind of grabbed concussion first because nobody was really looking at it, and so
Hmm.
the neuropsychologist got it. My dad, when he had his traumatic brain injury, it was the neuropsychologist that really revealed that there were things wrong. Because you walk into an orthopedic office, what are they doing? Nothing. They're not doing anything. And
Yeah. Yeah. You got it.
maybe, probably not even
Yeah.
that, and the neurologist, same thing. We talked about this before, where what the medical neurologist is doing, because, time, dictation of treatment or whatever,
And they're not going
saccades
to
are
do
intact,
therapy. It
saccades aren't
requires
intact.
therapy. There's no medication, there's no surgery.
Right.
And those things are essential sometimes, but not in
And,
concussion.
and the problem is, you're not going to give somebody a medication that makes a saccade more accurate or quicker in latency, probably.
Hmm.
Most of the time. What you'll see is the same thing you see with Parkinsonian medications. What you'll see is they'll move faster, but their balance is still really bad. Their
Hmm.
eye movements are still really dysmetric, all these kind of things. So it's like, well, the tremors are a little bit better. I can move a little more, but they still fall. They
Hmm.
still have these other issues.
Autonomic issues.
They have autonomic issues. They have
Yeah.
camptocornic posturing. or all these kind of things where they are not right with gravity. I had my fourth graders in today. I do this every year. I get a fourth grade class that comes in for career day, and it's like, what do you do? I say, the thing I do is I talk about the sixth sense, gravity, graviception, and so on. And I say my job is to make people as right with gravity as they can potentially be. And the thing with neuropsychs, when you look at one of the forms that we use in post concussion is the Rivermead post concussion symptoms questionnaire,
Hmm.
the
Hmm.
RPQ.
Yep.
You can use an RPQ, and what you can do is use an RPQ to kind of give somebody a concussion subtype. And what you've got a lot of domains. You're taking 16 common symptoms, and what we're doing is we're putting them into a cognitive fatigue domain, a vestibular domain, an ocular motor domain, an emotional mood domain, and a
Hmm.
headache migraine domain. And what you'll see is a lot of people will have mixed phenotypes. What is a neuropsych looking at? Cognitive only. They're really only looking at,
Hmm.
and you can get into frontal lobe function. Dr. Antonucci talks about this in the FN mock class. There are like 50 different frontal domains you can look at with different neuropsychology testing and things like that. But
Hmm.
again, we're looking at one lobe of the brain, and that's all we're looking at with
Yeah.
neuropsych testing. We're not
Well,
looking at any of the rest of the brain. And the problem
yeah.
is you can see frontal dysfunction, as we know, as a symptom of
Hmm.
dysfunction of these other areas of the brain.
Yeah. I'm just going to take a break here for a moment. While this podcast is for educational purposes only, we would love a like, a share, shoot, even a dislike, a comment, so that the algorithms pick us up so that people can, maybe learn a piece of information for their health, or doctors like to listen to this in the background. It's possible. But if you don't mind, like, sharing, subscribing, commenting, any of those things would be greatly appreciated. Thank you. I had a patient. First of all, I want to step back. Impact is meant for immediate. Like after an hour, that test is no longer valid. So to make that the gold standard to get back to play weeks later makes no sense.
Not only that, but it is a cognitive test. And what you'll see a lot of
Yes.
players do is tank their initial testing.
Yes. Their
So
baseline.
so their
Yeah. They
baseline,
can.
they try like 50% on their baseline. So when they're really screwed up, they can still pass it because
Yeah.
there are there
It's
are
not
financial
objective.
consequences. Yeah, there are
It's
financial
subjective.
consequences.
Yeah.
Yeah,
So the other thing, I had a patient once. I've had a few of these patients. Very alpha, in charge, smart. This woman was a nurse and a mom,
sure.
and I mean, did all the things. A trailer came the opposite direction on this single aid road. The trailer was not hooked correctly or didn't match the hook, came undone. That trailer hit her. She spun and somebody hit her. And that person managed to sue her, which makes no sense. Like,
It's interesting. Well, that's the thing with litigation. It's
yeah.
always a strange beast. And I like what you said too. I think that attorneys, much like doctors of chiropractic,
Hmm.
have some specialties, and there are some attorneys who are really good in my area with
Yeah.
traumatic brain injury litigation that I will try to steer people toward if I can. There are others who don't do so well. I was really happy. I had I guess I can brag about it now because it's all settled. We had the largest traumatic brain injury settlement ever with one of
Hmm.
my patients, and
Hmm.
it was great. And there's a whole load, depending on what state you're in, where um, maybe you can't be considered an expert because of the chiropractic license limitation or something like that.
Yeah.
But once
Yeah.
they've been diagnosed, it's like it has to be a medical diagnosis.
Yeah.
And then once it's diagnosed, and if you're in the loop, then you can talk about it, that kind of thing. It just depends on your state. So that's the thing. If you're a patient or a doctor of chiropractic listening to this podcast, make sure you know your state scope of practice
Yeah.
laws, limitations. It's always good to have somebody in your clinical constellation that has the MD as somebody who maybe agrees with your
And
opinion,
that's the
who will
insurance
state that.
machine. This is the insurance machine
Exactly.
equation. I refer out because I'm like, I need other people to agree that what I'm seeing is right as well.
You need a
That's
medical opinion,
yeah,
exactly. And the
correct.
problem is we don't technically in Nebraska render a medical opinion. So sometimes it's like I need an MD to say yes, they have a concussion or they've
Hmm.
got post-traumatic whatever. Go see Dr. McLaren, and then
Yeah.
I can kind of, as long as I'm not the only one commenting on it,
Hmm.
I was the lead on this case, definitely as the clinician, but he had a cardiologist and a primary care and a neurologist who all agreed. So it was really, I didn't have to be the only person on an island saying that, which is a precedent that isn't necessarily so good. And I've been on both sides of that argument, even though I am the most credible person on this as I'm Carrick trained, so on and so forth.
And
I
doing the therapy is
lost.
very different than being like, oh, there it is.
Yeah.
Whoop,
Well,
there it
and
is.
we've lost
No,
cases because I
it's a
was the
very
only
different
opinion.
thing treating.
Yeah.
Very different. And writing a report, okay, great. Now what? You
And
know?
that's the other thing. Like you said, the neuropsych is giving a report that is phenomenal on assessing those, maybe up to 50 domains of frontal lobe function,
But all of
plus or
that
minus.
money, here's how it looks. When you have this certain amount of money and thousands of dollars go to a report that does not help the patient, that's
It really
what's
doesn't.
frustrating.
Yeah. It really
It's
doesn't. That's the
that
other
money
thing.
really should be going to the actual therapy of the patient.
Yeah, you use that
Back
for
to
treatment
that
there.
back to that accident I was telling you about. This woman, she was very high functioning and she was a nurse and she'd say, "I'll be walking all of a sudden I go this way or I get stuck on stupid." And that's what her phrase.
Yeah.
And she would just get caught up in her thought, but she's very smart, just like this. And I'm like, "You're going to pass a cognitive test and it's not going to look like anything. You are failing in these objective tests that you cannot fake."
That's the other thing. You make a really good point. We talked about the football players tanking a test. The
Hmm.
other thing is if you get somebody who's a really high achiever like that, and again, like I said, I have this patient who's got, these issues, but she knows how to, like, she'll almost study for some of the tests because she really wants to
Oh,
pass
patients
because
all the
she's
time.
super
I practice
competitive.
this one at home. I
Yeah.
practice this one.
But she knows the cognitive testing so well. She knows all of the forms of
Yeah.
the mocha and all these things. And it's
Hmm.
like, I know what the three words are going to be.
Trails, all the things.
Yeah, yeah, yeah.
Yeah.
So it's like, and that's the thing. She's like, I can ace the trails test, but I still can't think when my kids come at me with 22 different things and we go, well, that's because your frontal lobes are actually pretty healthy and you're bringing a lot of material into it. Like
Hmm.
if you are somebody who is super duper smart and you get concussed, you're still going to look pretty smart.
Yes. It just, they say, I know I'm slower than I was before,
Yeah.
but they're still above
But
average compared to the population.
compared to the
Yes.
statistical norms, they're enough ahead that they're diagnosed as not a concussion or whatever it
Yeah.
is.
If you lose your job within 6 weeks because you're not quite the top of sales that you were before, there's clearly something going on, but you could
There's
still
a
be
deficit.
smarter than everybody else.
You can pass your impact test, so to speak. Yeah,
Yes. Yeah.
absolutely. And that's the thing. The patient you're talking about, I would imagine you're looking at doing an autonomic screen of some sort on this patient and seeing all sorts of orthostatic changes that weren't correct, all sorts of vestibulopathy,
Mm-hmm.
these kind
Mm-hmm.
of things. And I
Yep.
say these things, it's like, yeah, obviously what you're seeing is she's not regulating fuel delivery of blood and oxygen to her brain. She's
Mm-hmm.
not able to regulate subcortical structures, which the neuropsychology testing assesses not at all.
Mm-hmm. Yep.
And some of these vision therapists are kind of getting on track where it's like they're at least looking at people's balance along with doing vision therapy.
Yeah.
But neuropsychs aren't. That's the
Yeah.
thing. It's like if I put you on a piece of foam and I close your eyes and you fall off the foam, that's bad.
Yes.
But you passed your neuropsych test, so you've been told by this neuropsychologist who maybe again was hired by the other side's apparatus,
Or even the same
conflict
side,
of
doesn't matter.
interest.
They're passing the test that their tool that they know how to use.
Even if they're not necessarily in the interest of the insurance company to say that you're totally fine, you
Hmm.
you do you can only game the system so much with some of these tests too, which is kind of cool. But at the same time, yeah, I'm going to pass the cognitive domain, but you go, my vestibular domain is really terrible. Like I said, what were the domains we talked about?
Hmm.
My vestibular domain could be terrible and I can pass cognitively. My ocular motor domain could be absolutely terrible. I could have emotional mood things, which will also show up on that neuropsychology testing.
I see a
But
lot
even
of that
headaches,
too with blood sugar regulation, what your chemistry was like before the impact and,
yeah.
continuing
And
on
during
after.
the impact, it matters. Yeah. And
Yeah.
and the other thing is you're going to see a lot of emotional lability and things like that. But again, that may come up on the neuropsych testing, but it may not be enough to be diagnosed as a
Hmm.
pathological model for sure.
Well, and when we talk about the mechanism of injury, the most injured part of a brain in a concussion is the brainstem area. Those cerebella, those tracks, they get all yanked on. They're the ones, it's not always where you hit your head. Everyone's like, oh, that's where I hit. I'm like, well,
Yeah.
it's not exactly where the pathology usually shows up. They
Professor
can.
Eric said it. Yeah, he said it in our TBI modules. Think of the brain as a wet towel that gets twisted during
Mhm.
concussion, because
Yep.
very rarely is it going to be just a direct spot on midline force where you only get a backward and a forward shift,
Yep.
if
There,
ever, or
it's
side to
twist.
side. Yeah,
Well, and you
everything's
and
so small.
I, we took the brain dissection class together, the most recent one.
Yeah,
And we were blessed enough to get to touch a brain that was fresh, meaning the person had passed 24 hours before. So it wasn't like a stabilized brain.
they're not fixed. Yeah, they're generally fixed with chemicals, so you can
Fixed.
do some. Yeah,
I still remember what it felt like. And just to think, how do we not hurt our brains
yeah,
more is shocking.
it's
If
super
people could
fragile. Yeah,
respect, people don't respect their vestibular system until they get dizzy,
yeah.
truly, or headaches or this or that and the other thing. But if people could actually see these brains fresh, I would like to think that they'd respect their brains a little bit more.
You probably
But
see a lot less football players and a lot less mixed martial artists and
maybe, yeah.
boxers and all these kind of things. Except,
Hmm.
like I said, yeah, how many millions of dollars would it take for me to get punched in the face by Mike Tyson?
No, thank you.
Trying to think
Because
of the
those
number,
millions are going to go to rehab or your
I'm
funeral.
like,
It's hard to tell.
yeah, I'm like, well, the number's got to be a little higher after that class for sure.
Yeah, yeah. It's crazy. But yes, the area that gets injured the most is not always the frontal lobe. The frontal lobe is the last really to develop, as a baby, right? We develop all these other things. The frontal lobe, as it develops, you get that mood regulation. So
It's where that,
toddlers throwing fits, they're fatiguing that frontal lobe, and as they develop, they get better control of their moods. That's the whole point. So,
what do they say? I mean, the prefrontal cortex isn't fully developed until at least 25, maybe even they're kind of going more to like 30 now,
yeah,
where you see it just depending on
these
all
aren't
the
Gen
other.
Xers coming up. No, I'm just kidding.
Yeah. Yeah, yeah, Judge Zers, right? Yeah, the
Yeah,
Xers, we're good now. Like we're
yeah,
kind of the seasoned people, but
yeah.
that's the thing. So you look at that and then you take a brain like that under 25 years old, multiple concussions, the number is between 2 and 3 where you start to see permanent change in that prefrontal cortex and it's not fully developed yet and I've got
Mhm.
permanent changes. Now I'm on a mood stabilizing medication. Now I'm on an antidepressant. Now I'm on some other things
Which
because
aren't fixing
again,
function.
and they're not addressing these functional deficits. The other thing about the frontal lobe that's really fascinating to me is how it has a tendency to be able to compensate for some of these other areas of brain that are really functional or not functional in concussion. So
Yes.
frontal lobe says, well, okay, your parietal lobe isn't doing so well. I can kind of upregulate my function, take
Mhm.
over some of those aspects. And people go, well, I can kind of do the things that I can do, but I'm tired all the time. Well, yeah, your frontal lobe's doing
All
twice
the
the.
work. Yeah.
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 And I think about that. My wife was gone for a week last week, and nobody tell her that it was a lot longer week for me than it was when she was home, right? Don't
Uh-huh.
tell her
Hmm.
that I needed her as much as I did, but it's
Hmm.
like, man, I'm going to bed earlier, I'm sleeping longer, I needed a nap during the day if I could get it, all these kind of things because it's like, gosh, I got to run all the errands now and I've got to get
Uh,
up and feed the
so now
dog
you have a different appreciation. That's
all
what
the
they're
time. I mean, ask
yeah.
anybody whose spouse leaves, it's like,
Yeah.
gee, my wife or my husband does a lot of stuff and she'd say
Yeah.
the same thing
Yeah.
maybe when I'm gone.
Yeah. Yeah. There's a
But that's
point
the
that you
thing.
made.
The frontal lobe can do a lot of additional things. And again, that isn't going to be reflected in that neuropsychology testing necessarily either.
Yeah.
Except maybe they get a little tired and they can't finish the full test or
Yeah.
things like that. But again, if I'm bringing a little bit of cognitive, chutzpah to the dance before, yeah, I didn't quite finish the test, but I still got enough right that I pass. And
Well,
then
and
again, no concussion.
the cerebellum also comes out smooth as a baby. You develop all that folia. And if you're getting hit concussion before that's developed, which I want to say it was like by the teens, right? That was fully developed, but that it talks to that prefront. That cerebellum gets information from every part of the brain.
The longer you're in gravity, the longer you're moving. That's the thing. Remember, all these things are being driven by getting information from your world.
Hmm.
And again, my fourth graders, I asked them, it's like, what is the sixth sense? And one of them got it. He's like, gravity. And I'm like, yes, two stickers for you.
I
It's
almost
like,
call the neck. I
yeah,
call
well,
the
it's
neck the sixth sensory organ
yeah.
because it dictates where everything goes and
Proprioception,
it
yeah,
gets affected. But
proprioception could be
yeah,
too.
I agree. The gravity.
But yeah, that's the one thing that we never are, unless you go work on the International Space Station. It's the one thing that's constant with all of us. Earth's magnetosphere is right there too, right?
Hmm.
So gravity and magnetism are two things that we're constantly impacted.
Everything is a wave and a transfer of energy and a everything.
Yeah.
Yeah.
But those you can close your eyes, you can plug your nose, you can plug your ears, but you can't plug your gravity receptors ever.
Hmm. You can
So
only tilt your head or slide
and
or
that's the thing
roll
is that
or
you start to see in concussion because these things are in that midline brainstem area. Those are the things that are the problem. It's like, we get a head tilt, we get an eye that doesn't match the head tilt. We call that a pathological ocular tilt reaction.
yep,
People that have those things are miserable, but they can pass a neuropsych test all day long
yep,
potentially.
yep.
And it's
So,
another hallmark of concussion, traumatic brain injury, and some other things that if you're not looking for it, you're going to miss it, and you're not going
hmm.
to diagnose the person right, and you're certainly not going to treat them right.
And that's healthcare, right? Oh, we're not going to run that blood test because it might show there's something wrong. Then we'd have to cover it.
We might
You
see
know,
you
there's,
actually have some problems.
yeah,
Exactly.
yeah. All right.
And that's the thing. Again, I think that's where we say I character trained people, my opinion, and again, no disclosures. I am a character trained person,
Yeah,
but character trained people are the best people in the world at looking at
yeah.
these things.
And we need more trained through the Carrick Institute. There's
Absolutely.
nobody else like them.
Yeah,
Nobody else.
absolutely.
He was the creator, is the creator.
Yeah, still is.
It
Yeah.
still is. There will be a day, obviously, where that's not the
Thank the
case, but
Lord, he is still here.
we
Absolutely.
would get, it behooves us to really funnel into making that the strongest foundation.
Yep.
Then maybe we get some quote unquote competitors because competition can help things grow. But you
Sure.
have to get that stronghold in there first
Yep.
for people to be willing to do it. And I think, what dictates it is money. Who's willing to take insurance, who's not willing to take, what will insurance cover? You got to go out of it. You got to get out of that system to be able to apply the stuff to help patients. And it has to come from that grassroots effort. That's the
Yeah,
biggest
and,
thing.
and that's the thing. And to get the information out there that looking at this stuff, if you're a traumatic brain injury patient, is more valid and worth it for you. The juice is worth the squeeze, so to
Hmm.
speak, in the treatment. It definitely, because that's the thing. It's like I'd rather be fully functional than get a settlement if I have to decide between the two.
Mm.
Not to say that you're going to be fully functional necessarily,
Yeah.
but I'd rather take my chances that way. If I had my druthers either way,
So
um,
where I could argue, if the neuropsych test held all that weight and they were able to get the policy limits that they needed, that patient, the theory is that they get that money so they can then go pay out of pocket for whatever therapy that they need.
now you've
So,
got the
I mean,
issue of
there's a lot to it. That's why
prescription.
the attorney deals with it. That's their job to think about all that stuff. But
Yeah, that's the thing. Get it, and that's the thing too. It's great. Absolutely. And that's the other thing too. I am not a big fan of is where people are told you're only going to get as better as you can in your first year, or you're only going to get as better as you can in your first two
right.
years. You can continue to get your nervous system healthier throughout the entire lifespan. So it's like
Have you
get
ever
your
learned
supplement.
anything later in life?
Right.
Well, it's
Yeah,
the
yeah,
same neurons.
man.
It's the same thing.
Yeah, even after a
Yeah.
brain injury, right?
Yeah.
And that's the thing. It's very much where you go ahead and get your settlement, but please get the treatment that you
Yes.
need and
Don't
find
go
some
on a
that are
vacation.
trained out there.
Go get therapy.
I mean, you can do both. Could do the vacation and therapy, but
It depends.
definitely
But if I'm
do the vacation and
prioritizing,
go get therapy.
yes. Yeah, correct.
Do your
But if I'm
vacation at Dr.
prioritizing,
Brown's office.
yep,
It'll be
prioritizing,
your best vacation ever.
yeah. You're prioritizing your life and your health. You're not going to perceive a vacation appropriately if your brain's broken.
100%.
Yeah, is there a stress component? Sure, that could go away, but you still haven't, it's not going to fix a vestibular problem.
You still need your balance fixed. You still need
Mhm.
your autonomics fixed. Absolutely.
Yeah.
100%.
But priorities is kind of where a lot of that comes from. Was that your beat?
No, I think I have to go.
Oh, okay. Okay. You're in trouble. Get out.
Yeah, yeah,
Okay.
yeah. Your
All
lobby
right.
is full of people. Nah, it's fine.
Okay.
So
All right. Well, we
I
ran
think
late
that's a
because we
great,
were, talking to others, but
yeah. I
we'll,
think that's a great topic though, and I think it's
yeah,
something that a lot of people don't talk about
yeah,
for
I think
sure.
so. And it's not poo-poo the neuropsychs, but
Not at all. Not at all. There is a lot of
TBI
validity.
is really where it's an objective, there are objective measurements, milliseconds that are never going to be seen on a cognitive test.
Absolutely.
So, all right.
Perfect.
I will talk to you later.
All right. Great to see you.
You too.